Oh my, look at all these cases that came in over the weekend. It looks like there are quite a few cases of this reportable disease. This might be an outbreak. Evelyn, look at this. A bunch of cases of this disease came in via CDRSS. Is this what an outbreak looks like?
Sally, that does look troubling, but we will need to investigate more. If this is an outbreak, there are specific steps we would need to take.
Evelyn, what exactly is an outbreak? How will I know?
An outbreak is an occurrence of disease that exceeds what is normal for the area. Outbreaks typically involve 2 or more cases and can vary in magnitude and complexity. Be suspicious when you see more cases than usual of a certain disease. CDRSS is a tool that we use to identify outbreaks.
All outbreaks are reportable. Be sure to alert the health officer as soon as you think one might be happening. She needs to stay in the loop about the investigation. The health officer will assist with prioritizing the response and delegate duties.
We also need to contact our regional epi to let them know we are seeing more cases of the disease than usual, and we think it might be an outbreak. The regional epi will then provide us with an E-number. The E-number is like a tracking number for outbreaks and investigations that require significant public health action. This means that all of the communications and response for that outbreak event can be identified and kept together. Typically, when we recognize an outbreak, we make a preliminary hypothesis about the exposure and at-risk groups. This is also done to implement public health actions, such as control measures. Control measures vary by host susceptibility, mode of transmission, and reservoir.
Meaning certain people are more susceptible to the disease than others?
Yes. For instance, with childhood diseases such as measles, those who are at highest risk are individuals who are not vaccinated. For other diseases such as influenza, typically younger and older people are more at risk, as well as those with weakened immune systems, such as people with cancer or HIV.
When investigating an outbreak, it is important to determine who was exposed. All of the individuals with similar symptoms or with positive lab reports should be called and interviewed. This is the role of the local health department disease investigator.
We need to determine if there is any commonality among the cases, such as did they have any common exposures? When did they get ill? What are the symptoms that made them go to the doctor? Have they traveled anywhere recently? Etc.
All of the info should be summarized in a line list. You may remember we talked about line lists in Video 2, Epidemiology 101. Line lists describe the person, place and time, and look at trends over time, geographic context, and affected populations. Some of the info may be in CDRSS, but not always. Disease investigators often call the patient or healthcare provider to get more information. A line list is an important tool during an outbreak. As the outbreak is investigated, the line list should be updated during the outbreak response. This includes adding new cases, analyzing data, and more. Work with the regional epidemiologist to determine if there is a need to do a patient notification to identify people who may be exposed but may not know or have not seen a healthcare provider to get tested. Sometimes not all cases associated with the outbreak are in CDRSS. Only positive lab cases are reported to CDRSS. We know that not everyone who is ill sees a healthcare provider and gets tested.
Sometimes a single case of disease may not look like an outbreak at first, but over time, additional cases are found. During the investigation, you may notice that there are some commonalities, such as where people live, eat, or travel. For instance, one case of scabies is not reportable, but you may see multiple cases in a long-term care facility.
Recommending prevention and control measures is another important step in outbreak investigation and response. Depending on the disease, control measures may need to be implemented immediately to stop the infection from spreading. Control measures may include public health actions such as hand hygiene, vaccination, cleaning and sanitizing surfaces, and isolating sick people from well people. After implementing control measures, the disease investigator should monitor CDRSS for new cases associated with the outbreak to determine if additional measures should be taken. This is important to ensure that the control measures implemented or recommended were adequate or need to be fine-tuned. When the disease investigator sees no new cases reported in CDRSS within 2 incubation periods of disease, the outbreak can be declared over. Remember, each disease has a different incubation period, and they vary greatly. Once the outbreak is over, a final report must be written and submitted to the state within 30 days. It is always good to reflect after an outbreak is over to determine what worked well during the investigation and what didn't work so well. This will help with future responses and investigations.
Epidemiologists have a saying, once you've seen one outbreak, you've seen one outbreak. All outbreaks are different and have their own challenges. But the more experience you have responding to outbreaks, the more comfortable you will become as a disease investigator.
Outbreaks sound much different and more involved than just a single case of disease. Yikes. But with my disease investigator training and the help of my supervisor, I think I'll be just fine.